Takulandirani ku AMTV Malawi kuchimake kwa nkhani zenizeni. Ngati nkhani imeneyo kuno kulibe, dziwani kuti nkhani imeneyo ndi yabodza.
Shall we pray? Almighty God, who in your wisdom and goodness has appointed office of rulers and parliaments for the welfare of society and the just government of the people, we ask you to behold with your abundant favor us, your servants, whom you have pleased to call to the performance of important trust in this land. Let your blessings descend upon us here assembled, and grant that we may treat and consider all matters that shall come under our deliberation in so just and faithful a manner as to promote your honor and glory, and to advance peace, prosperity, and welfare of this country and of those whose interests you have committed to our charge. Amen.
General business, communication from the chair.
Good morning, honorable members. Let me take the House to standing order number 2054B4. Sorry, let me take it again. Let me take the House to standing order number 2054. The standing order says that a party whip shall ensure that the Speaker is informed of any absence before the start of a sitting. So, honorable members, I would like to ask our whips, both from the government side and the opposition side, to report to my office why other members are not here. The office of the Speaker is having 3 leave of absence from 3 members only. So my expectation is to see the full House. Thank you so much.
Item 2, general business, questions or notice to ministers for oral replies.
Honorable members, I recognize the honorable we go for, okay, leader of the House. Thank you.
Thank you very much, Second Deputy Speaker. Good morning. I beg to move that the order paper be varied in order that we start with questions to the Minister of Lands, Housing and Urban Development. I beg to move.
Thank you so much, honorable members. There is a motion. The motion is that we vary order paper in order to start with questions under Ministry of Lands. Those of the opinion say aye. Those of the contrary opinion say no. The ayes have it, and the motion is carried. Okay. Honorable members, let me call the honorable member for Nzimba South to confirm his question. Honorable member.
Madam Second Deputy Speaker, firstly, before I confirm the question, let me congratulate you because I'm standing for the first time. Whilst you are sitting there, congratulations for winning. Muti Milira, we love you. You are a good lady. Madam Second Deputy Speaker, on behalf of TM Mzogozoko, on behalf of Inkosana Chitete Jere, and on behalf of the Area Development Committee of TM Zuguzugu, they are worried. That's why I'm here, Madam Second Speaker, to confirm that question number 10 on the order paper really comes from TM Zuguzugu, Nkosana Chitete Jere, and the ADC Chair, Mr. Zambo. Thank you.
Thank you so much, Honorable Member. Honorable Minister responsible for lands.
Thank you very much, Madam Second Deputy Speaker, Madam. And through you, let me thank the Honorable Member for the question. The question is to ask the Minister of Lands, Housing and Urban Development to explain why the project for constructing 5 police officers' houses at Mbangweni Police Unit has stalled at roofing level and indicate when construction will resume and be completed. Madam Second Deputy Speaker, Madam, as you are aware that government through my ministry is constructing houses for Malawi Police Service across the country under the construction of 10,000 houses for security institutions project. Mbangweni Police Unit in Mzimba district is one of the sites that is benefiting from this project to help ease pressure for accommodation for our men and women in uniform. Madam Second Deputy Speaker, Madam, according to reports in my office, the 10,000 housing units which were for the benefit of selected security institutions are allocated as follows. The Malawi Police Service has got 4,000 houses. The Malawi Defense Force, 4,000 houses. The Malawi Prison Service, 1,000 housing units, and the Department of Immigration and Citizenship Services, 1,000 housing units. Of the 10,000 housing units, Madam Speaker, Madam, 3,972 housing units were tendered and offers of contract award issued. These were split in phases as follows. Phase 1, Lot 1, 231 housing units. These are at 85% completion. Phase 1, Lot 2 has 797 housing units, and the completion rate is at 80%. Phase 2, Lot 1 has got 2,300 housing units, whose progress is at 15%. And Phase 2, Lot 2, these are 11 MDF hostels in lieu of the 644 housing units, and contracts were awarded. Only 3 of the 11 contractors have managed to submit contract prerequisites. Madam Speaker, Madam, 122 houses of the awarded contracts were completed and handed over to the beneficiaries for occupation. There are more houses, with some at foundation and others almost completed, whose progress has stalled due to cash flow challenges, due to rising costs of materials, and the delayed payments. The delayed payments have to a greater extent been the lack of provision of funding to my ministry for payments to be processed. Madam Second Deputy Speaker, Madam, my ministry will request for provision of these funds for the completion of houses, as the delays are proving costly by exposing the project to time overruns and contractual claims. Another challenge that has delayed the houses, Madam Second Deputy Speaker, Madam, is the need to comply with contractual claims and procurement guidelines, where rising prices for materials affect the agreed contract sum. As you are aware, Madam Second Deputy Speaker, Malawi has in the recent years experienced a sharp rise in the cost of construction materials. This has led to claims for additional amounts to be added to projects by our contractors. My minister has been reviewing these and getting necessary approvals through the internal procurement and disposal of assets committees so that we are compliant with the law. The process has, in most cases, taken longer than anticipated. The third challenge, Madam Speaker, has been personnel. The project is being supervised by an implementation unit within the ministry, which is in need of more experts in architecture, quantity surveying, and engineering. Madam Second Deputy Speaker, my ministry has deliberately delayed the tendering of the remaining 6,028 housing units to ensure that we first clear the challenges faced in the implementation of the first and the second phases. In closing, Madam Second Deputy Speaker, let me advise the people of Simba South that the housing units at Mbangweni are part of the houses that are now at roofing stage, and the expectation was that they would have been at a more advanced stage by now. The contractor was already paid his first and second certificates. The contractor has submitted his third claim, which our project manager is assessing for certification. My ministry is taking every effort by engaging the contractor to ensure that works resume while the certification process is being finalized. I thank you, Madam Second Deputy Speaker,
Thank you so much, Honorable Minister. I now recognize the owner of the question, then the Honorable Member for Zomba Malosa, then Honorable Member for Nkatabe Chinteje. In that order, please. Thank you.
Thank you, Madam Second Deputy Speaker. Firstly, let me thank the Minister of Lands for his comprehensive, very touching feedback that he has given in this honorable House, more especially needing it down towards Mbangweni Police Unit. I just want to thank him. My supplementary question is that maybe he hasn't finalized his answer as to when they will be completed, because the minister knows Mbangweni very much. It's a highly populated trading center, and we really need those houses to be completed as soon as possible. So maybe if he can finish his answer as to when the houses can be completed. I know he has got so much passion to have those houses complete because he knows the place. Thank you so much, Madam Second Speaker.
Thank you so much, Honorable Member. Honorable Member for Zomba Malosa.
Thank you so much, Second Deputy Speaker, for giving people of Zomba Malosa to ask a supplementary question to the Minister of Lands. The Minister of Lands, people of Zomba Malosa, would like to ask consideration on police houses at Domas Police Unit. As a Member of Parliament in 2019 to 2025, CDF, I tried to put a structure there, very good police building, just right along the road. I asked the former government for houses, they did not. So I have trust in the government of Professor Thabira Mutarika through your ministry that you will consider Domas Police Unit to have houses. Thank you.
Thank you so much, Honorable Member for Zomba Malosa. Honorable Member for Nkatabe Chinteje, you have the floor.
Thank you very much, Second Deputy Speaker, for giving Nkatabe Chinteje a chance to bring it to the attention of the Honorable Minister of Housing that at Chinteje Police, we also benefited from these houses. They were roofed, but as of now, they're stored. So I would want to ask the Honorable Minister, as he's thinking about finishing the houses in other areas, he should also consider Chinteje, because we've got a serious challenge of houses at Chinteje. We've got about over 42 officers, but most of them live in rented houses, which are not very, very good. So if we can be considered on this one, then at least Chinteje will be as people of Nkatabe Chinteje will be very happy. I thank you very much, Second Deputy Speaker.
Thank you so much, Honorable Member for Nkatabe Chinteje. The Honorable Minister responsible for lands.
Thank you very much, Madam Second Deputy Speaker. Madam, for the opportunity to respond to the three supplementary questions. One from the owner of the question, Zimba South, pretty much asking for when exactly will these houses be completed. Madam Second Deputy Speaker, let me just assure my honorable colleague that we will be having a meeting with the Minister of Finance, because the issue is financing, to see how the ministry would assist us with resources that would enable us complete these houses. So as soon as we have the commitment from the Minister of Finance in terms of financing, you can let's be assured that we will make sure that those houses are completed. It's the wish of this government that projects that are critical like this one are given all the support they require so that our men and women in uniform live in comfort. So as and when the assurances have been made, I will come back to this House and give you the clear timelines when we should be completing those and other housing units spread across the country. Zomba Malosa, need for houses at Domasi, where a unit has already been built. I can assure you, honorable member, that Domasi will also be considered for these housing units alongside other, police formations. Chinteche, the house is already roofed and just awaiting completion. The response would be the same because it is a financing issue. Once we have completed the discussions with the Minister of Finance, we should be able to provide in this House when these houses will be completed. It is the wish of government that all these houses are completed so that our officers are living in decent accommodation. Madam Second Deputy Speaker, Madam, I submit.
Thank you so much, Honorable Minister responsible for lands and housing. We have completed the 3 supplementary questions. Then we go to questions under the Ministry of Health and Sanitation. I now recognize the Honorable Member for Rumpi West to acknowledge the question. Honorable Member, you have the floor.
Madam Second Deputy Speaker, Madam, Rumpi West stands here to confirm the question standing on my name represents the cries, the tears of people of Paramount Chief Chikura Maembe from 2013 to date. I know the minister is a new minister. She may carry good news for these people since they've been crying for all these years. Congratulations, Madam Minister, as you bring good news in your response. Thank you.
Thank you so much, Honorable Member. The Honorable Minister responsible for Health and Sanitation, you have the floor.
Thank you so much, Madam Speaker, Madam. And through you, let me thank the Honorable Member for the question. The question is to ask the Minister of Health and Sanitation to explain when the ministry will fund the completion of Kampenda Health Center, whose foundation was laid in 2024, but the construction has since stalled, despite being cited in the 2025 State of the National Address as completed. The project, which began in 2013, was affected by the Cashgate scandal. Only the outpatient department, built with the JSID funds, have been completed but remain unopened. To respond to this, Madam Speaker, I thank the Honorable Member for Rumpi West for the question regarding the status of Kampenda Health Center. Madam Speaker, construction of Kampenda Health Center has stalled for an extended period due to funding gaps, resulting in delays in completing the essential structures required for the facility to become fully operational. Madam Speaker, the current status of the project is as follows. The OPD, outpatient department, the block for OPD was constructed through the JSID funds and has been completed, has been electrified, and has been handed over by the council to the council by the contractor on 14th November, that's just last week. However, it has not yet been operationalized because the complementary structures such as staff houses, pit latrines for patients are still outstanding. Madam Speaker, the ministry is committed to ensuring that Kampemba Health Center is completed and operationalized without further delay. To this end, we will prioritize mobilizing the required resources from both government allocations and also development partners to finalize all the remaining components, including the maternity wing. That's the good news that I carry today. My ministry will prioritize unfinished projects in the coming financial year, and Kampemba will be among them. The ministry will also ensure transparent and timely updates as the project progresses. I thank you, Madam Speaker.
Thank you so much, Honorable Minister responsible for health and sanitation. I now recognize the owner of the question, Chikwawa West, and Nkatabe Central, in that order, please. Thank you.
Thank you for the good response. Through you, Madam Second Deputy Speaker, Madam, the second question is based on policy. What is the policy guideline within your ministry? Here we have an OPD that is said to be completed, no toilets, no staff houses, no maternity wing. I believe there is no any medicine or furniture inside the structure. And this building has been built within the shortest period after the SONA mismatched with the actual things on the ground. And for your information, Madam Minister, through Second Deputy Speaker, Madam, the contractor was mobilized the day the SONA was presented, and he is on site. He has been staying there almost 1 year. He only dug the foundation. What is the policy of government in such scenario to fast track? Because the contractor has not, is just staying idle, and we don't know when the funds will be mobilized, and we don't know whether he's going to be paid. What should be done to this contractor who is there? Because me, as a member of parliament, I've been feeding him. Feeding his workers.
So much, thank you so much, Honorable Member.
So that the SONA should seem like working. What is your policy like in terms of finding resources so that they can do the work?
The floor is now given to the Honorable Member for Chikwawa West.
Thank you very much, Second Deputy Speaker, for recognizing the people of Chikwawa West to ask a supplementary question to the Minister of Health. We have a similar situation in Chikwawa West at Gaga Health Center, where some OPD and lab, the project stored in 2013 as well, and the issue mentioned was about Cashgate. So just want to find out from your ministry. I've been raising this issue for some time now, and we were promised that something will be done to finish those projects. So it's like a follow-up just to find out when should we expect these projects to be completed. Secondly, we were informed that Gaga Health Center as well as Chabananga Health Center will be upgraded to rural hospitals. I just wanted to find out from you, the Minister, what is the status, the update on this project of upgrading these two health centers. Thank you very much, Second Deputy Speaker.
Thank you, Honorable Member for Chikwawa West. Now go to Honorable Member for Nkatabe Central.
Thank you very much, Madam Speaker. Second Deputy Speaker, Madam, congratulations. Madam Second Deputy Speaker, I would like to ask the Honorable Minister, like Kampemba Like Chikwawa West, the same situation is also in Nkatabe at the Lonya Clinic, popularly known as Dindano, Sabuti E Mundola. The contractor was sent, but she only did the foundation, nothing more than that. Now she has disappeared, we don't know where she is. The clinic in Nkatabe at Lonya or Dindano, there's nothing, but you said as a contractor, we are also tired of seeing the contractor with only a foundation. Using JZID, we also, the Nkatabe District Council constructed total clinic. This is the second one, total clinic. The building was done, but the infrastructure, the equipment inside, there's nothing, no med. Now the building has become a white elephant. Honorable Minister, Madam, can you come to our rescue in Nkatabe at the total clinic? Thank you very much, Madam Second Deputy Speaker, Madam.
Thank you so much, Honorable Member for Nkatabe Central. I now recognize the Honorable Minister responsible for health and sanitation. Madam, you have the floor.
Thank you so much again, Madam Speaker. And thank you, Honorable, for the supplementary question. And to answer it in terms of what is the policy saying, as the national health policy, indeed, when construction has started, it is ensured that it is finalized. However, as I mentioned, that funding gaps formed part of the bigger challenge in the completion of the health center. I would like to assure you that my ministry has prioritized Kampenda Health Center, and we will ensure that we find funds through donor and other government, and through government funds, we will ensure that all the facilities have been finalized and the Kampenda Health Center is operationalized. Responding to Honorable Chikwawa West, the same issue, similar issues of projects, Madam Speaker, that have not yet been finalized. And I'm also assuring Honorable Member from Chikwawa West to say we are prioritizing, and be assured that once we allocate the funds, we will be finalizing all the projects that started and have not yet been finalized. And responding to Nkatabe Central, where Lonya Clinic and of course Total Clinic, the building was done, but again, not finalized. Indeed, as I said, the funding gaps really affected the ministry. But as you are aware, we are going to use the government resources. Even in the next financial year, we will prioritize all these projects because there are many that have not been finalized. And I can assure you here that these projects that started will be finalized. Thank you, Madam Speaker.
Thank you so much, Honorable Minister responsible for health. We now go to second question. I now recognize the Honorable Member for Nchewu Central East to acknowledge the question. Honorable Member for Nchewu Central East, you have the
Thank
floor.
you, Madam Speaker, for recognizing the people of Nchewu Banje South to ask the Minister of Health to consider constructing a health center at Upper Makwangwala, specifically at Mvimbo
Honorable
headquarters.
Member, you have just to acknowledge the question. You have already asked the question. The Minister is aware of your question. Just confirm that the question is indeed coming from your constituency.
Thank you, Madam. Deputy Speaker. Indeed, I confirm that that question is indeed from the people of Nchewu Central East, specifically from Upper Makwangwala. Thank you.
Thank you so much. Honorable Minister responsible for health and sanitation, you have the floor.
Thank you, Madam Speaker. And through you, let me thank the Honorable Member for the question. The question is, to ask the Minister of Health and Sanitation to consider constructing a health center at Upper Makwangwala, as people currently travel long distances to access health services at Birira and Kaunene health centers. To respond to this, Madam Speaker, my ministry recognizes the importance of construction of a health center to better serve the communities of Upper Makwangwala. Madam Speaker, Upper Makwangwala has a population of 72,934 and currently accessing services by 4 health facilities, namely Sialuzu, Dzunje, Nsipe, and Birira health centers. Despite them accessing services from the health centers, 4 of them, the area remains underserved due to significant distances between communities and existing facilities. For example, Sialuzu Health Center is approximately 29 kilometers from Birira Health Center. And again, whilst Nsipe is about 19 kilometers from Sialuzu, these long distances contribute to delays in seeking health care and impose transport costs that further limit access, particularly for vulnerable populations. Madam Speaker, as per national policy, the National Health Policy, my ministry strives to ensure that no person travels more than 5 kilometers just to access essential health services. Clearly, Upper Makwangwala falls outside the standard. Recognizing these challenges, my ministry, in collaboration with Ncheu District Council, will consider the construction of health center at Upper Makwangwala through available financing windows. Furthermore, Madam Speaker, I wish to inform the House that the need for additional health infrastructure in Upper Makwangwala has already been included in our integrated capital investment plan, which guides the prioritization of future health infrastructure investments. These interventions will enhance service coverage for surrounding communities and support progress towards achieving universal health coverage. I thank you, Madam Speaker.
Thank you so much, Honorable Minister. Before I take supplementary questions, Honorable Minister, I have noted that your allocated seat is 11 and you are speaking from seat number 13. So the rule of the House is that you should be speaking from your allocated seat. Is there any explanation? My office is not aware of that. Thank you.
My apologies, Madam Speaker. I will since allocate to my seat. Thank you.
Thank you so much, Honorable Minister. I now recognize Cholo Tegeran. Cholo Tegeran. Then the Honorable Member for, remind me your constituency, Honorable. Nchisi West. And the Honorable Member for Chikwawa Central West. In that order, please.
Thank you so much, Second Deputy Speaker, sir, for recognizing the people of Choro Tegeran to ask the Minister of Health a supplementary question. But before I come to the question, let me once again congratulate you, Madam, for attending that seat. Madam Second Deputy Speaker, mine is not a new question to the ministry. It's just a reminder to the minister, because I've been arising in this chamber asking the same question to the Minister of Health. So, Madam Minister, it's just a reminder. I've got 2 reminders to you. We have Mpande Health Center and Nkata Ombere Health Center. These health centers have been there for so long. They were renovated sometimes back, and before the renovation, the health centers were operating, but because there were some damages, so the workers, especially the medical assistants, were taken there to other health centers. So after renovating the health centers, we tried to get some equipments from Tegerani Rural Hospital, and the Tegerani Rural Hospital shared other equipments to these two health centers and are there. What is lacking is the officers to start working at these two health centers. So I've been asking for these officers to start working at these two health centers, but the ministry were responding positively to the questions, but up to now, they haven't deployed the officers to start working at these two health centers. Do you please check and help us so that if these two health centers have started operating, they will really decongest Tegerani Rural Health Center. My second reminder to you, Madam Minister of Health, is that at Tegerani Rural Hospital, we have an X-ray machine. It was commissioned by former Deputy Health Minister, but up to now, the machines are there, staying idle, not operated. Would you please check and help us so that maybe the machine should start working there? I understand that it's just the technician, the one who knows how to operate the machine, to come and start working at Tegerani Rural Hospital. Do you please help so that maybe people in my constituency should stop going to Choro Hospital to get this kind of service? I submit, Deputy Speaker, sir. Madam.
Thank you so much, Honorable Member for Cholo Tekeran. Before I recognize the Honorable Member for Nchis, let me take the House to Standing Order 65-2. Standing Order 65-2 says, supplementary questions shall arise directly from the answer to the original question and shall not be used to introduce matters not included in the original answer to the question, or purport to raise a new matter on the floor of the Assembly, notice of which has not been given. So the question was to do with the construction of a health center at Upper Makwangwala. Now, if you are bringing the issue of equipment and the other things, the Honorable Minister is new, and she might not have enough information to serve you well. So I would ask the Honorable Member, though it is a reminder, but the Minister is new. So the best way is to put your question in writing so that you should be able to get the response from the Honorable Minister responsible for health. Thank you.
Madam Speaker.
Okay. The second reminder is from Standing Order 190. Standing Order 190 G says that a supplementary question is for a minute. So, honorable members, if we can stick to our standing orders, we will give chance to more members to speak. Thank you so much. I now recognize the honorable member for Nchisia. Thank you. You have the floor.
Thank you, Honorable Second Deputy Speaker, for according the people of Chiefs West the opportunity to interface with the Minister of Health. My supplementary question to the Minister is to do with the health center at Kalasankua in the senior group Chimbalu. This health center stored a long time ago. I would want the ministry to consider completing the health center so that the people around Chimbalu, Kalasankua, Bingamvula, Ngwanje and other surrounding areas can access the health services without having to go to Kamsonga, which is 10 kilometers away. Beside that, Madam Deputy Speaker, I want the minister to consider constructing a health center around Sub-Tier Masanya, where there's no health center and the people there rely either Malomo or Kamsonga, some 15 kilometers away. Thank you, Madam Second Deputy Speaker.
Thank you so much.
But before I sit, Madam Deputy Speaker, let me congratulate you for your ascendance to that position. I will congratulate the other speakers when they recognize me. Thank you.
Thank you so much. Thank you so much, Honorable Member. I now, Honorable Member for Chikwawa.
Chikwawa Central West.
Chikwawa Central West. You have the floor, please.
Thank you so much, Honorable Second Deputy Speaker, Madam, for recognizing the people of Chikwawa Central West, more especially from the people of Undilande, Second Inchalo, and the Zilonzo villages. Under your indentures, Madam, I would like to ask the Minister responsible for health to consider completing Tizola Clinic, which was funded by GEST, but up to now it is under construction and there's no progress. I would also like to ask the responsible minister to consider upgrading Hunger Project Clinic into a health center, because in my constituency there's no health center, there's just a clinic. I think it is the only constituency in Malawi that doesn't have a health center. In Chalo, trading center is a very big trading center, but we don't have a public institution, public hospital. Thank you. Thank you so much.
Thank you so much, Honorable Member. Honorable Minister responsible for health and sanitation, you have the floor.
Thank you so much, Madam Speaker, for giving me the opportunity to respond. Firstly, let me thank the Honorable Member from Cholo South, Tekelani, who asked the ministry and reminded the ministry of the work that was promised here in this August House. Madam Speaker, as you mentioned, I also noted the same, that this is a new question, and as a new question, it will have to be asked, and my ministry will provide proper response. But I would like to thank the Honorable Member from Choro South Tekelani for reminding the ministry and appreciating the reminder, and he wants us again properly, will provide proper responses. I would also like to thank the Honorable Member from Munchisi West for asking on behalf of Kala Sakua, people of Chimbalu and Ngwanje. It is true, and indeed the ministry acknowledges that long distances affect health services. And it is my assurance in this August House that my ministry will look into this. We are already identifying the funds to support construction and also completion of projects that already started. I'm also thanking Honorable Member from Chikwawa Central West for asking on behalf of people from Undilande, people from Unchalo, about completion of Zola Clinic, which was funded by JESID, but did not complete. I am assuring the people of Chikwawa Central that my ministry, as I've said earlier on, it is indeed making sure that we have funds and resources that would enable us to finalize the said clinic. I'm assuring him that resources will be identified and we will not get tired until the project is finalized. I submit, Madam Speaker.
Thank you so much, Honorable Minister. We go now to question number 3. I now recognize the Honorable Member for Salima Central West to acknowledge the question. Honorable Member for Salima West, Central West, you have the floor.
Thank you so much, Madam Second Deputy Speaker, Madam, and I bring you greetings. Because I'm interacting with the Honorable Minister for the first time, I want also to congratulate her for the appointment that she's gotten to be the Minister of Health. Madam Second Deputy Speaker, I stand here to confirm that question number 3 appearing on my name on today's order paper indeed comes from the people of Salima Central West constituency. Thank you.
Thank you so much, Honorable Member. Honorable Minister responsible for Health and Sanitation, you have the floor, Madam.
Thank you, Madam Speaker. Through you, let me thank the Honorable Member for Salima Central West for the question. The question is to ask the Minister of Health and Sanitation to consider opening a newly constructed maternity theater at Kombeza Health Center, which was built with support from Empath Project. The opening of this theater would greatly assist expectant mothers who currently travel long distances to Salima District Hospital to access maternity services. While considering the opening of the center, he also asked the Minister to consider constructing additional staff houses to accommodate medical personnel who will be operating at the facility. To respond to this, Madam Speaker, I thank the Honorable Member for Salima Central West for this important question regarding opening of maternity theater at Kombeza Health Center, and also the need for staff houses. Madam Speaker, Kombeza Health Center, with catchment population of 69,389, approximately located 30 kilometers from Salima District Hospital, indeed has a theater building constructed under the Empath Project. My ministry recognizes the critical role this facility could play in improving access to maternal and emergency obstetric services for women who currently travel long distances to the district hospital. Madam Speaker, the theater has not yet been operationalized due to the absence of key supporting infrastructure. Also, services required for safe surgical operations. Specifically, Madam Speaker, the facility does not have a functional laundry block for the cleaning and sterilization of theater garments and linen. Further, Madam Speaker, the said facility does not have a fully equipped laboratory to conduct the minimum essential test prior to surgical procedures. These are not yet in place. Madam Speaker, recognizing these gaps, my ministry has already earmarked Kombeza Health Center for upgrading into a community hospital. The project has been included in the Integrated Capital Investment Plan, and Kombeza is among the facilities proposed to benefit from hospital rehabilitation and expansion works for the coming fiscal year. These works will include construction of the required theater support structure, as well as additional staff houses to accommodate clinical personnel who will be operating at the facility. Madam Speaker, the ministry remains committed to ensuring that Kombeza is fully upgraded and operationalized so that the people of Salima Central West can access comprehensive maternal and emergency health services closer to their homes, and also in line with our goal of improving equity and reducing delays in accessing care. I thank you, Madam Speaker.
Thank you so much. Supplementary question from the owner of the question. Another supplementary question from our former VP. And the last one, the Honorable Lady from Doha Central. Thank you so much. In that order, please.
Thank you so much. Madam Second Deputy Speaker, people of Salima Central West constituency, I greatly appreciate the response from the Honorable Minister. We partly satisfied, but probably she needs to do more and find out, because this facility was completed, I think, around 2020, 2021, fully furnished with working anesthetic facilities. And she may wish to know, Madam Speaker, that even the anesthetic machine is being borrowed, taken by Salima District Hospital, fixed at the District Hospital, in the name of borrowing up until now. It means that the facility was well equipped. And that brings worries to us, because health facilities that would have been benefiting and reducing walking distance and access distance to District Hospital, it's still there. The problem is still there. Tavita would have been benefiting, NEMA would have been benefiting, Chitara Health Center would have been benefiting, Makion, but look, women are taken all the way to Salima District Hospital. And the equipment is being taken. Can you please expedite putting together all what has been submitted? The issue of laboratory, but the project itself, the scope, that was completed, and it should have been functional. Yes, we appreciate the need for the laboratory prior to surgical services.
Remember, Honorable, it's
yes,
a minute.
I just want to,
Thank
yes,
you.
I'll be finishing, sorry, Madam. But I just want to enlighten some other things that probably when she's responding, she should take care of, and when she's finding more. Madam Second Deputy Speaker, I've got also a policy question. I know in respect to standing order number 65, but I have a policy question to the Honorable Minister. If she's aware that health workers that are deployed in hard-to-reach areas are struggling to find accommodation, our nurses and doctors, clinicians, and allied staff workers are struggling to find a decent accommodation, is the Minister having a policy, deliberate policy, to construct staff houses to hard-to-reach areas for these health workers, in addition to the effort that the previous government made to construct health facilities? They are there are so many, but they came without a package of staff houses.
Thank you so much, Honorable
having a policy
Member.
to construct
Thank you so much,
for our
Honorable
nurses
Member.
and doctors, so that at least they are accorded decent accommodation? Thank you so much.
Thank you so much, Honorable Member, for your supplementary question. What has gone out of order, Honorable Member for Zomba Malosa?
Second Deputy Speaker, is it in order that the former Deputy Minister of Health should be asking a one-month-old Minister of Health about policies in this House, about accommodation of nurses or whatsoever? When he was on that position for over 2 years, he never did anything. Is that in order? Thank you.
Madam Speaker, Madam Second Deputy Speaker.
No, I haven't given you the floor. I haven't given you the floor.
Without being
Honorable Member,
confrontational to my...
please. I haven't given you the floor.
A policy question. I want to understand the policy direct.
Honorable Member, order. Honorable Member, please.
For the sake.
Honorable Member, please. Please order. Thank you. Honorable Member from Zimba, our former VP, you have the floor.
Thank you very much, Deputy Speaker, for recognizing Zimba Southwest for the supplementary question. Deputy Speaker, through you, let me congratulate first our own sister from the only kingdom we have in this country, Kingdom of Mzimba, under the Ngoni, Jerengonis. So congratulations, our sister, for attaining that position. Having said this, let me also, I was trying to look for a standing order, Deputy Speaker, but I couldn't get one. What I wanted to say was, is it possible that the Honorable Minister of Health would just bring maybe a comprehensive statement looking at the issues. For example, almost in every constituency, you find at least a health center that was started, not completed. You find shortage of staff in most of it. You find most of the clinics don't have enough medicine. So my question, that's why I'm saying I couldn't find a supplementary, I couldn't find a standing order. But is it possible that she comes with a comprehensive statement to encompass most of these issues so that maybe all of us can be enlightened? Otherwise, we'll be asking the same questions. I submit.
Thank you so much, Honorable Member, our former VP. The last one is Dowa Central. Thank you.
Thank you so much, Madam Deputy Second Deputy Speaker, Madam, for recognizing the people of Dowa Central. First of all, let me congratulate you for being ascended to such a higher position, especially being a woman. We are so much proud of you. I would like to congratulate our Minister of Health. Being a lady, we are so much proud of you. This morning, I would like to ask the Ministry of Health, mine is an appeal. We have Mponela Hospital, which was the contract. I just want to appeal to the Ministry of Health and Population to redeploy the contractor to complete the construction of Mponela Hospital project, which was requested by then the DPP legislator, who is my mentor, Honorable Gina Fazema Nachika. And this hospital started in 2020, but after 2 or 3 years, the contractor was removed from the site. And this hospital, it has taken another 2 years now. It's just dormant the way it is, and the contractor is not there. And Mponela Hospital is a very big hospital which takes so many patients surrounding so many trading centers, villages. The one that we're using now is just too small, and people are really suffering there. Just wanted to ask the Ministry of Health, please, if possible, if you can send back the contractor to Mponela Hospital. Another thing is, I would like to ask the ministry if they can consider constructing another hospital, a health center at Chimwaza, because most of the people surrounding this area are the poor people. They cannot manage to go to Ntengwa Hospital, which is a private hospital. So people from this area, they suffer a lot. Please, Madam Speaker.
Thank you, Honorable Member.
To the Ministry of Health.
Thank you so much, Honorable Member, for Dowa Central for those questions. Honorable Minister responsible for Health and Sanitation, you have the floor, Madam.
Thank you, Madam Speaker. Firstly, let me thank the Honorable from Salima Central West for your supplementary question. I would like to assure you that my ministry will do more. And you've said that you want this to be handled with speed. Be assured. That is why you have the able minister who is youthful, who will handle these issues with speed. Also, just to mention that my ministry is aware of the issues of staff houses, and will come back with more responses in regards to this. To respond to Honorable, the former VP, to come up for the ministry, to come up with a ministerial statement on a number of issues that are being highlighted in this House. Madam Speaker, I would like to agree with the former VP. Most of the issues that are coming, they keep repeating themselves, and the answer remains the same. It is clear that there were challenges. And it is because of these challenges that ministerial papers and statements will indeed come in this House. As you are aware, this is just the beginning of the third week. We have papers that are outlining these challenges and how my ministry are going to solve them. So this is noted, and we'll make sure that we bring the ministerial statements. Madam Speaker, to respond to Honorable from Doha Central, first, let me thank him for the question. Indeed, Mponela Hospital is a big hospital. The ministry is aware. It has large population. Depending on it, be assured that we are identifying resources, and once the resources have been found, the contractor will be redeployed. Thank you, Madam Speaker.
Thank you so much, Honorable Minister responsible for Health and Sanitation. We now go to question number 4. I now recognize the Honorable Member for Machinga Southeast to acknowledge the question. Honorable Member for Machinga Southeast, you have the floor.
Thank you very much, Madam Second Deputy Speaker. Before I confirm the question, let me congratulate you for saying your position. Madam Second Deputy Speaker, I rise to confirm that question number 4 on today's order paper stand for me is indeed coming from the people of Machinga Southeast. Thank you, Madam Second Deputy Speaker.
Thank you so much, Honorable Member. The Honorable Minister responsible for Health and Sanitation, you have the floor, Madam.
Thank you, Madam Speaker. And through you, let me thank the Honorable Member for Machinga Southeast for the question. The question is to ask the Minister of Health and Sanitation to upgrade Chipolonga Dispensary to a full health center as people in the area travel long distances to access health services at Chikwilo and Namanja health centers, and construct a new health centers at GVH Adamson and Mulaluwere to improve access to health services. Madam Speaker, I thank the Honorable Member once again for Machinga Southeast for the important question regarding upgrading of Chipolonga Dispensary to a full health center, and also the construction of new health centers at GVH Adamson and Mulaluwere. Madam Speaker, Chipolonga Health Post, with catchment population of 43,656 and located approximately 15 kilometers from Chikwiro, is indeed a priority facility within the Machinga District Council Health Infrastructure Development Plans. My ministry recognizes the burden placed on the people of the area who currently travel long distances just to access services at Chikwiro and Namanja health centers. Madam Speaker, I wish to inform this House that upgrading of Chipolonga Health Post to a full health center is already in progress. Construction of a maternity wing began using CDF resources and is scheduled to complete in the next financial year. This initiative aligns with broader district plans, which also include the upgrading of Chikwiro Health Center, serving a population of 1,026,886, into a community hospital under the Presidential Initiative on Maternal Health. Madam Speaker, on the construction of new health centers at GVH Adamson and Mulaluwere, the ministry, through the Machinga District Council, is implementing a phased approach. The district plans to construct new health posts at strategic points, including GVH Adamson and MALAWI, to reduce travel distances and improve service availability. These facilities are incorporated into the Integrated Capital Investment Plan and the District Implementation Plan, financed through a mix of local development budgets and support from development partners. Subject to the availability of resources, Madam Speaker, once established, these health posts will be considered for upgrading to full health centers as population growth, service demand, and resource availability permits. Madam Speaker, the Ministry remains committed to ensuring that the people of Machinga Southeast have improved equitable access to essential health services in line with the government's broader goal of strengthening primary health care delivery across the country. I thank you, Madam Speaker.
Thank you so much. Supplementary questions. I recognize the honorable member for, remind me your okay, Leader of the House. Honorable, may you please sit. Let's listen to the Leader of the House.
Second Deputy Speaker, Madam, I beg to move that question time be extended to allow ministers to respond to questions that are appearing on today's order paper. I beg to move.
Honorable members, there is a motion on the floor. The motion is that question time be extended to allow honorable ministers to respond to all the questions. Those of the opinion say aye. Those of the contrary say no. The ayes have it. The motion is carried. Supplementary questions. Honorable member for Chitipa South. Leader, okay, honorable leader of opposition. Then, honorable members, do you please sit and listen to the leader of opposition first? The leader of opposition, you have the floor.
Thank you very much, Madam Speaker. Madam Speaker, I rise on a very important issue. You remember, Madam Speaker, that I always, when I speak, end up with the Ubuntu philosophy of one Malawi, one people and one nation. Yesterday, Madam Second Deputy Speaker, the former president spoke to the nation, acknowledging that Professor Peter Mutharika, the president of this country, accepted him to travel to Tanzania to broker for peace. Madam Second Deputy Speaker, this cannot go without us mentioning it in the House. We've been in clear consultation with the leadership from the government, and I hope government will finalize all the logistical arrangements for the former president to travel to Tanzania. Therefore, my standing Second Deputy Speaker was actually to acknowledge the good gesture that has been done. What has been demonstrated by the two leadership is a clear testimony that Malawi is one. Therefore, we believe in one Malawi, one people, and one nation. Madam Speaker, I thank you for your attention.
Thank you so much, Leader of Opposition. Indeed, we would like to thank the Honorable President, His Excellency Professor Arthur Peter Mutharika, for the good gesture. Thank you so much, Honorable Leader of Opposition. Honorable Leader of the House.
Thank you very much, Madam Second Deputy Speaker. Just to indicate in this House that His Excellency the President, being a statesman, believes in inclusivity, and therefore every available resource that can be used to assist anywhere else on this planet, he is glad to do that. And therefore, we will ensure, government will ensure that the former president is facilitated to go and do just to our colleagues in Tanzania. I wanted to put that on record. I thank you very, very much, Madam Second Deputy Speaker.
Thank you so much, Leader of the House. I now recognize the Honorable Member for Chitipa South, then Honorable Member for Lilongwe City Mloza, and the Honorable Member for Zomba Ntonya. In that order, please. Thank you.
Thank you so much, Second Deputy Speaker, for granting the people of Chitipa South an opportunity for them to ask a supplementary question to the Minister responsible for health and sanitation. Madam Deputy Speaker, the question is, the people of Senior Chief Nhalile and Senior Chief Mwenewenya want to know when the theater will start operating at Nhalile Rural Hospital, given the fact that the anesthetic machine was already procured. I submit, Madam Second Deputy Speaker.
Member for Lilongwe Mlozi constituency, you have the floor.
Thank you, Madam Second Deputy Speaker. First of all, allow me to congratulate you for sitting where you're sitting. And then also, I would like to congratulate the Honorable Minister of Health, the one that I've known for quite a number of years as a hardworking person. Congratulations, Madam Minister of Health. Going to my question, Madam Second Deputy Speaker, I would like to ask the Honorable Minister of Health if her ministry could consider constructing a new health center in Lilongwe City, Mloza. The reason I'm asking this is because since the newly demarcated constituencies, what it means now is we only have Chilinde Health Center, which is no longer part of this constituency. So I would like to ask the minister that this is a constituency that literally has no even one single health center. Maybe if she could consider constructing a health center. Thank you, Madam Second Deputy Speaker.
Thank you so much. Honorable Member for Zomba Ntonya, you have the floor.
Thank you, Madam Deputy Speaker, for giving opportunity to people of Zomba Ntonya for a supplementary question. For us, it's a similar situation to what my brother from Machinga Southeast has raised, the upgrade of Chanda dispensary to a full health center. So I would like to ask the minister responsible to also consider the Chanda dispensary. Thank you.
Thank you so much, Honorable Member. Honorable Minister responsible for health and sanitation, you have the floor, Madam.
Thank you so much, Madam Speaker. And also let me thank Honorable Member from Chitipa South for the question. He is concerned that in Nhalile, people from Nhalile, Mwenye are not yet benefiting from a machine that is there but not yet operationalized. Madam Speaker, this forms part of a new question altogether, and it's a deviation from the question that I was asked. I'll humbly ask the member, the honorable member, to use proper channels to request it again, and we will come back with an informed response. I would like to thank also the people from Lilongwe City, Mloza, for the good question and the concern And my ministry has just noted with concern that currently there is no health facility in City Mloza. Again, much as it has been noted, be assured that my ministry has also taken note and will come back with a proper response, and will ensure that we include this in our plans. Let me also recognize the question from Zomba Ntonya, which is similar to that of Machinga Southeast. Indeed, we have incorporated your request to upgrade, sorry, I've forgotten the name of the hospital, but we have included it in the Integrated Capital Investment Plan and the District Implementation Plan. Be assured that we will follow up and to ensure that all plans that were started are completed, and where upgrading is required, we will do that. I thank you, Madam Speaker.
Thank you so much, Honorable Minister responsible for Health and Sanitation. Honorable members, I've got 2 announcements before we go for health break. I would like to inform the August House the presence of distinguished visitors in our gallery. We have visitors from Dowa Central constituency. These are chiefs, group village headmen from Dowa Central. May I ask our chiefs to stand up so that your members of parliament see you. Magogo atu imirirani zikomo, and the honorable member for Dowa Central, please. Thank you so much. Thank you. Thank you so much. Honorable members, order, honorable members, order, honorable members. The other announcement is to inform the August House the presence of chiefs from Zomba City North. Honorable chiefs from Zomba City North, may you please stand up so that your members of parliament sees you. Honorable member for Zomba City North, yeah, please wave your chiefs. Thank you. Zikomo kwambiri mafumu onse kuchokera kudowa komanso kuchokera ku Zomba City North ku parliament takulandirani. Zikomo kwa ma MP anu kuti akwanisa kukubweresani kunoko sizophweka. Thank you so much. Honorable members, is 10:56. I now adjourn the House to 24 minutes. I now suspend the House to 23 minutes past 11. House suspended.
Osaiwala kupanga subscribe ku channel ya AMTV Malawi.